is Thursday, so of course we are talking about investing for retirement with Jonathan McCoy from Market Advisory Group. We have him every week and we just learn so much. So thank you so much for being here.
Yeah,
again.
absolutely. It's always a joy.
Well, we appreciate it. And you know, we're talking a little bit about financial planning for long-term care. There's been some recent changes, hasn't there?
Yeah, absolutely. And of course, we're going from one end of the spectrum with entertaining children
Right.
to the other end, the very other end of the spectrum, which is not always so fun for folks to think about, which is, you know, what happens to you, your family members in the event that you are needing some sort of long-term care, whether it's, you know, in-home nursing care or in a facility, whether it's a nursing home or skilled nursing facility of some sort. You know, long-term care policies recently especially have become not only more difficult to afford, but a lot of times these policies will sort of shift the ground beneath our feet, where the premiums can change over time, the coverage amounts can change over time, and really that's a representation of insurance companies struggling to price a lot of these plans, struggling to come up with an idea of how long are people going to be living in nursing facilities. So a lot of these companies have created products that are more creative and designed for sort of today's world of nursing care, where maybe you don't need nursing care and most people are trying to stay in their home as long as possible. Many of these policies will start to pay out even if you're in the home, not in an actual nursing facility, whereas some other policies are a little more strict in terms of what benefits they're going to pay out and where, you know, sort of what level of care do you need for those policies to pay.
Yeah, and those are some of the things that you kind of have to feel out as you go, right? So do you think that people who come to you, do they have a good handle on the costs that life-changing events will bring, or are they coming to you asking those questions?
I think frequently they're coming to us asking those questions. It's, you know, not only how much is a long-term care insurance policy going to cost, but you know, how much are typical people having to dole out of their life savings and their retirement investments to care for themselves. And then of course, you know, at the end of the day, the ultimate safety net for us is Medicaid, but that's not a very comfortable situation also. You basically have to drain yourself and your family of assets to be able to get on Medicaid, so the state will take care of the cost of your care, and even then they can be, you know, clawing back the cost or the value of home and other properties even after you pass away. So having some sort of plan in place, whether it's self-insuring, making sure that you've got part of your financial plan set up to cover those costs yourself, or looking at what some of these policies may be able to cover in terms of the overall cost to sort of shelter a portion of your assets against long-term care expenses is a key component of retirement planning in general, because that can become a significant portion of the budget if you're wanting to insure yourself against it.
Okay, and then people are coming to you to address these long-term care questions. Is it happening often? Are they doing it early enough, or would you recommend starting that process
as early as possible is best. I mean, even while you're still working, a lot of folks are coming in and talking to us, you know, when they're in their 60s, mid-60s, or even 70s, and you know, there are some age-related factors there. The older you get, the more likely you are to need some sort of nursing care, so insurance companies are going to bump up those costs. The earlier you can get in on locking in potentially some lower rates or more beneficial rates in terms of not just traditional long-term care insurance, but a lot of the other insurance products that exist. There are life insurance and certain annuity products out there that also can provide enhanced benefits if you end up in a long-term care situation. So, and a lot of those policies will still allow you access to your cash value. So if you don't end up needing it for nursing home care, that you could still have access to the cash, which is something that traditional long-term care may not provide. So just looking at all your options as early as possible and getting that locked in as soon as possible is the most cost-effective way to plan for it.
Sure, and then of course coming to you with the just comprehensive team and support that you provide. That's why you're the expert.
Yeah, it's tough to do on your own. You know, there's a lot of research involved. So.
Well, thank you for everything that you provide. Thanks for your time today as well.
Thanks a lot, Jillian.
Yeah, of course. So to schedule your complimentary consultation and submit your questions, visit askouradvisor.com, or you can give them a call, 816-548-2000. They'll take your questions and even meet one-on-one free of charge with you. If you include your address, Market Advisory Group will send you a free gift.